Well, CBD oil is widely available now, and people can buy it over the counter. And some people do find it useful. But over the last 2 years, I've built up a great deal of experience using cannabis medicines. And it's important to say that cannabis medicines contain much more than CBD. They contain THC, which is a controlled medicine, plus many other substances. And we've been having much more success with proper, full prescription cannabis medicines than CBD oil. They can help people with long-term pain and low mood and poor sleep much better than CBD, and actually much, much better very often than the morphines and the pregabalins and all of those medicines, which often don't help long-term pain and can actually be so burdensome because of their side effects. And cannabis medicines are far less likely to make you dependent on them than morphine or pregabalin, for example. CBD oil is widely available to buy over the counter without a prescription, and that's a good thing. Some people are helped by it, but many, many people are not really helped by it, and they still have long-term pain. So full prescription cannabis medicines can be much better than CBD oil. They contain THC and many other substances such as terpenes. And the expertise that I've built up using those medicines is really worth considering if you've got pain and you can't sleep and you feel low in mood and anxious and so on. And they will be far less burdensome to you in terms of side effect profile than many conventional medicines are. Cannabis medicines certainly can help with chronic pain, with long-term pain. Cannabis medicines are one of the few medicines that really work in the central nervous system, in the parts of your brain and spinal cord that process the experience of long-term pain. And this is where pain is really experienced, in the central nervous system. And the cannabis medicines get in there, many others don't. But they can also relax your painful muscle spasm, and they can help you get a proper night's sleep, whereas pain is preventing your sleep. They can relieve the anxiety that's caused by pain. And so cannabis medicines are a very good fit for people with long-term pain, and we can often reduce their other pain medicines that are not helping so much. CBD oil can be useful for pain relief, and a few people do find it helpful, but using full-strength cannabis medicines that contain THC and other substances such as terpenes is generally so much better and so much more effective for so many more people. And without causing sedation or causing people to feel high, cannabis medicines can be so much better than conventional medicines such as morphine and pregabalin, which can often cause very unpleasant side effects. Many, many patients can benefit from full-strength cannabis medicines, particularly people with fibromyalgia and related symptoms from Ehlers-Danlos syndrome, where pain processing mechanisms just go completely wrong, and where people get painful muscle spasms and so on. People with nerve pain are often very much helped by cannabis medicines, and people towards the end of their lives, maybe receiving palliative care, can be helped so much as well by cannabis medicines, where we can relieve them of the burden of morphine and so on, so they can be more relaxed and happier and more awake to be with their families at such an important time.